choice for today, Mariam. Mariam's a director for Women in the City, but a really inspirational speaker. Not that I want to overly build her up, but a fantastic choice for today. Someone with lived experience, and I think is going to really, really help lift today and help us get the most out of it. So without further ado, could I ask you to give a really warm welcome to Miriam Mola.
My life took a massive turn after making some really poor choices in my teens, and something I did almost 8 years ago caught up with me, and I found myself in Holloway Prison. My experience in Holloway Prison wasn't the very best experience. If I'm sincere, up until when I was about 8 months pregnant, hospital appointments were missed. I was promised to be taken to a mother and baby unit. Those things weren't given to me. Food, I believe there was even months in prison where I just ate bread because they kept forgetting things like, you know, what I'm allergic to, what I can't have. It wasn't a fair experience for a mother who's expecting a child for the first time in prison. From Holloway Prison, I went to a hospital in North London, and in the hospital, to be honest, I had a better experience in the hospital than I did in Holloway. I stayed there for 3 days, but it would take maybe 2 weeks or 3 weeks to get the visits organised, and eventually she does come to see me, and it's about 30-45 minutes. There are no toys in the playing area. The food is terrible. People are screaming, people are crying. So I'm thinking, how can we work together to humanise that experience? Maybe not for me, but what about her? She's not a prisoner, and nor is the family friend.
I am the Executive Director for Safety and Rehabilitation in HMPPS, but I started off as a researcher in the Home Office, focused on prisons research. And one of the things that I did was an evaluation of mother and baby units in prison. I also evaluated parenting courses for young fathers in YOIs. It was a while ago. But, you know, things have probably moved on, but a real good wake-up call from Mariam, that we've made some progress, but we've still got a way to go. And that engagement and that voice is so powerful. So thank you again. So look, it's really good to be here. I'm excited to be here to meet. I'm looking forward to talking to lots of you today, actually. And you know, I was reflecting, looking at that invite list, attendee list, and thinking we've got people from HMPPS, from charities, from the voluntary sector, independent organisations, service providers, academia, many other areas, all coming together on this really important agenda. And it's that partnership working, isn't it, that's going to be so fundamental in helping us to push things forward, as Mariam has challenged us to do. So I want to just say a few words of thanks, though. I do want to thank Lord Farmer for his ongoing commitment to strengthening family ties, reducing reoffending, public safety, aligned beautifully with our strategic priorities. Thanks also to Anne Fox, CEO of Clinks, Deputy Chair of the Review. So, as you know, First Farmer Report focused on the Mel estate and Angela Christopher. So Angela worked really closely with Richard and led on the Strengthening Family Ties policy, which was published in January, so well done to you. And Angela is now the National Families Advisor, working on the implementation of that new policy framework and farmer recommendations. So seeing all that policy through, right through to implementation, so that's brilliant. Thank you, Angela. Tim Lloyd.
Hi everyone.
So Tim is the head of family services, which includes the public-facing core services, including help with prison visits. Really important. Thank you. Do we have have Stuart Harrington in the room?
Already stood up.
Brilliant, brilliant. Hiding behind there. We should be filming you, shouldn't we? Who's our family's communications lead. And so I'm just going to finish there actually, and I'm going to end.
Just let me talk more widely here, okay? Lord Farmer and I keep emphasising that family and other relationships need to be a golden thread running through every department of government, not just criminal justice. Stronger families are vital to every Secretary of State's priorities. So we continue to press for a cabinet level minister. We need, this is a cabinet committee for the environment that's been called for many years, well, for even longer. Since Lord Lamming did the harrowing Victoria Columbia review, he's called for a cabinet level committee for children and families. So that is what we are asking for, a champion or whoever to knock heads together and make sure government works together to give family policy the cross-government push it so badly needs. So be inspired. You don't just run family programs or facilitate visits. You are part of a family strengthening revolution, which is going to impact tangibly and also immeasurably beyond prisons, beyond rehabilitation, and greatly benefit wider society. Thank you.
Hi all. So, as Mariam said, my name's Nabila, and over the course of the past year, some of you may have met me, but I've been acting as a needs analyst, researching factors contributing to why prisoners do not receive social visits. So today I'm here to share with you all some of the key findings on what I have found, and in the time I have with you today, hopefully we can get a conversation going into why is it prisoners do not receive social visits, and more importantly, what changes can we implement to improve the uptake of social visits. As the slide behind me shows, I have analysed 10 prisons. I don't know if you can all see. I have analysed 10 prisons for the quantitative data and 7 for the qualitative data. Now, the qualitative data was collected from 3 key participant groups. The first was where I interviewed 51 prisoners, including a sample of female prisoners. Secondly, focus groups were held with prison staff at each of the establishments. And thirdly, families and significant others were another key group of participants. Admittedly, families and significant others were the most challenging group to gain access to, but with the help of PACT and NEPACs, we were able to hold focus groups with that group of people, and as well as hold semi-structured telephone interviews. Some of the
we need to use that data and evidence to develop an informed response. So if you know how many prisoners in your establishment are not receiving visits, then how are you using that data? Is there a standing agenda item on your family strategy group, for example, that looks at the data from your safer custody call centre, from your APVU claims, from your number of prisoners who are not receiving visits, and uses that data to inform your service development in this area? Promoting a think family approach, it's that commitment that needs to be communicated to staff so that your prison staff, your prisoners and your families are aware of why it's important, and it needs to be a cross-departmental approach. It shouldn't just sit in your reducing reoffending teams or your ops teams. It needs to be something that education, health, OMU, all of your departments are working together on, and innovation and shared practice. Shared practice needs to be a lot more developed across prisons, as one staff member said to us, which is what the publication of these resources and briefings we hope is contributing to. Thank you.